Well, Freeman, another issue that is just, you know, like I said, I try to stay away from political stuff, but
Right.
it's just all around you. It's everywhere.
Exactly.
And this affordable health care, to me, should not be a political issue, but it is. What can you share with us about the Affordable Health Care Act? Because so many people are confused about it. They don't know whether it's good, they don't know whether it's bad, they don't know whether it's in between, if it will really help or if not. Businesses have gone nuts.
Exactly.
Trying to figure,
Yeah.
what can you share with us?
Well, I've examined the Affordable Care Act, and it was enacted back in 2010. One of the provisions was that allowed young adults up to age 26 to remain on the parents' health coverage or health insurance. But starting this year, there has been there's increases for high income earners. It's sort of associated a little bit with Medicare. You can expect in 2013 an increase in the cost of Medicare, the Part B aspect of it. You can also look forward to in 2014 that everyone in the United States could have universal health care. Now, you can get more information on the website justaskfreeman.com, and where I have a life guide which outlines the 5 core provisions of the affordable health care.
Oh, okay.
I've seen that some folks in various media, they say, well, I don't want Obamacare, I want affordable care.
They don't realize,
they don't realize it's the same.
Yeah.
Alrighty.
Yeah.
So you can go to justaskfreeman.com and then download the guide that I have there, and I list all the provisions. We can also look forward to the fact that next year the employers with 50 or more people, the big companies, they're not obligated to provide health insurance.
Oh.
Okay.
Okay.
But they may be subject to what we call, let me refer to it, shared responsibility payments.
And what is that?
Okay, this is where they are fined a certain amount of mandated, a certain amount of money if they don't provide the coverage or they don't meet the or satisfy the individual mandate. But many of the big companies can do that if they offer health coverage. Okay. So, the affordable health care too is a good thing because what it does, it provides health coverage for millions of people with pre-existing conditions. So the insurance companies will not have to increase premiums. And also, like I said, the pre-existing conditions did not shut out an individual for having the health coverage, because prior to the Affordable Care Act, you had, and we paid for it as taxpayers, many individuals would have to end up going to an emergency room. That was their primary provider. Right. Okay. So this offers solace. Employees of small companies, that is fewer with 50 employees, is not required to provide health coverage either. But they will have an opportunity to get credits if they provide the health care for their employees.
It's like tax credits.
Yes, they will get the federal tax credits to help with the cost of providing health insurance. Now, the higher income individuals, beginning this year, as I mentioned, additional Medicare taxes are paid by higher income folks on their wages, and for the first time on net investment income. Now, again, you can acquire the guide on affordable health care. I got available there that would tell you the different levels of income or net investment income, and where you will be assigned or assessed a mandate type of fee if you don't offer health insurance. Exactly. Medicare, speaking of Medicare, it has added free preventive services and Medicare Part D, which is the prescription drug. Right. Right. Coverage gap, well, that's going to slowly close by 2020. And so Medicare currently covers about 38 million people. And as a result, we can see the Medicare pilot programs too that will be implemented. So you're going to have a lot of free screenings. Even myself, I'm going to get my flu shot. And
Yeah, I got to get mine.
that's right. I'm going to run on over there to my physician, take care of that. So if you want more information about the Affordable Care Act, like I said, you can go to my website, justaskfreeman.com,
Good.
and download that healthcare provision there for you.